Welcome back, everyone, to another edition of Disruptive Dental Science podcast brought to you by the Dental Advisor Group. I am Dr. Ashton Prince, and I am joined by my colleague, Dr. Matthew Miller. We are clinical ambassadors for Dental Advisor, and we are thoroughly enjoying the time that we get to spend with you. Our amazing, and I will say truly amazing, guest that we have with us today. Dr. Joy is how we refer to her. Dr. Joy Poskozim is with us today. Dr. Joy, how are you this morning?
I'm wonderful. How are you guys?
We're doing fantastic.
Fantastic.
Well, Dr. Joy, the thing that we really have enjoyed about this Dental Advisor podcast is that we are trying to find ways to improve the abilities for the dentists that are out amongst not just those that are in our neighborhoods, but those across the country, even across the world, for the outreach that we actually have. And the reason that we were so excited to have you on here is because you look at things a little differently than what the rest of us may. Would you mind telling us a little bit about yourself and where your passions are in the field of dentistry?
So I practice on the north side of Chicago. Go Cubs. And I have 2 days a week. I'm with my practice, so it's a family practice. And then 3 days a week, I work in the long-term care communities. They no longer like to be called nursing homes, so long-term care communities. So I treat everyone from independent living who have chosen not to drive anymore, or they cannot drive anymore. They choose to stay in place. Assisted living, skilled nursing, hospice, and memory care. And so that's generally speaking how long-term care communities are being broken up. And so when I go into a home, what I'm going to be looking for are things that we might not be necessarily looking at when we're in our dental offices, in our operatories, with everything available to us. We do a lot of triage ahead of time to make sure that I know exactly what to bring. And I have different bags for different treatments that I will be providing, everywhere from cleanings and exams to my removable pros. If I need to re-cement a crown back on, which happens a lot after the holidays, and I bring my tools for that. And then, of course, extractions if necessary. So these are the things that I'm bringing, but we try to get a lot of information first from the families, as well as from potentially, if they're available, the floor nurse or even the director of nursing, if possible, so that I know what I'm, getting myself into, quite honestly.
Sure.
When I'm in the patient's rooms. And I like to do their treatments in their rooms. This is where they feel the most comfortable. And in this situation, it's really irrelevant if they're in assisted living or in memory care. This is their space, and I am their guest, and I am being welcomed into their room, in their space, to be able to provide care for them. And it really comes down to, I was a Girl Scout, right? So sometimes we have to really think outside the box when it comes to what I'm going to be using. I don't always have access to gauze. Sometimes I run out of gauze. So we're using toilet paper, or we're using Kleenex for me to wipe off my instruments when I hand scale a patient. And, it really is wonderful that I try very hard to incorporate the people that are working there, the caregivers that are there. The nurses, for the most part, are doling out meds, right? This is their first and foremost job that they do. And so I'm really working with the caregivers, and I want them there bedside or chairside or wheelchair side next to me, so they can see what I see. I'm only there for a half hour, 45 minutes at a time. I'm there once a month unless there's an emergency. But these are the people that are really going to be taking care of them. And so I want them to understand what I'm looking at, what my priorities are, what my concerns are, so that, on a day-to-day basis, they can also be focused on that with their residents, and they can also hopefully achieve, good oral health for these residents, whether or not they can, these residents can do it for themselves or not.
Wow. So you're gathering this information by way of a phone call, or is this just your usual visits you're making to try and get that understanding as to what you need to bring the next time? Or how is it you go about gathering that information?
Exactly. So what we're required to do in Illinois, every state is different, but in Illinois, all we need is a verbal consent from
Okay.
the power of attorney. But and there's a whole nother podcast for this, but we really need to know if there's a Medicare or medical power of attorney, financial power of attorney, or both, right? Because the medical power of attorney will say, yeah, go ahead, do it. Go make them another denture. And the financial power of attorney is like, no, we're not making another denture. She's 91 years old. So I'm looking at,
Oh, the joy.
concerns of failure to thrive. I'm looking at issues that, will hopefully the loved ones involved will appreciate when it comes to the treatment. So we have to know those things ahead of time. I'm an independent contractor. I am not hired by any of these homes. I am walking in as an independent contractor, and so therefore these are their residents. All information about these residents when I do my documentation is in their charts. I do not carry that with me. I make my own notes. And then what I do at the end of the day is I will email the director of nursing with the room number to try to keep it as, HIPAA compliant as possible with my findings. And ideally, all I want to say is WNL NSF, right? That's what I want to be doing. But a lot of times it's not that case, and so then I'm writing or typing in my phone a lot of information that the director of nursing needs to be informed of. And so yes, my front desk coordinator is the one who gathers as much information as possible. She's been working with me for over 10 years, and she knows what questions to ask. Questions such as, manual, something as simple as manual or electric toothbrush. She's not really, brushing her teeth anymore. She really hates the electric toothbrush. Okay, well, she has Alzheimer's and she's in mid stage, and that's understandable. Maybe she's not really not liking brushing her teeth anymore. Maybe it's the feeling of the electric toothbrush. Maybe if we switch down to a regular toothbrush, she'd be more compliant in wanting to brush her teeth. Let's give that a try. So I'll make sure that I'm bringing my toothbrushes. I'm making sure that I bring my fluoride varnish and my SDFs, and my those things are always in my to-go bag. If I see something, then I will say something to the family. I will call ahead of time and say, hey, I would really like to apply this material on somebody. Let me explain why. I get permission first. My first and foremost, when I'm there, is an exam and a cleaning, unless there's a specific purpose for me to be there. A denture is lost, a tooth has fallen out of a denture, so on and so forth. But
Nice.
yes, as much information as possible ahead of time, and whether it's from the family or from the director of nursing, it really depends on the home and how involved the directors or the DONs, the directors of nursing, are.
Good heavens. You're very right. This could be an entire different podcast as to gathering
Yeah,
the information, how you do it, how you go about it. So
yeah.
you cued into something that I found very kind of interesting. Um, when you first go into the room, just to make sure that we've got those that are looking into potentially dealing with
Mhm.
their geriatric or their even sometimes their pediatric patients, you can even treat them the same way at times. But for a patient like this, when you go into it, you said that you've got this armamentarium of things that you bring with you, your SDFs and your fluoride varnishes and everything else to it. When you first walk into a room, very beginning time that you've gone into it, what do you look for first?
I'm in their bathroom. I want to see what
Hmm.
kind of toothbrush they're using. I want to see the quality of their toothbrush. I want to see, do they have enough toothpaste? What kind of toothpaste are they using? I
Okay.
want to see, has this toothbrush, especially if I'm seeing them after lunch, has this toothbrush been used today? Is it dry? Is it wet? Is it caked with toothpaste? How about the quality of the actual toothpaste tube? When's the last time this toothpaste been used? It's that provides a lot of information for me on how well this person has been treated in said home. If the toothbrush, it's 1 o'clock in the afternoon, the toothbrush is dry as a bone. I know this mouth was not brushed after breakfast.
Sure.
Or brushed at all. I mean, most of the time it's called toileting. You will probably never heard that term again. I heard it twice yesterday in one of the homes I was in yesterday. Yeah, so when they're in the toilet or when they're on the toilet, that's when teeth are being brushed.
Oh,
Wow.
okay.
I'm just going to let that sink in.
Yeah.
That
Well,
is the easiest time for the caregivers to have this person brush their teeth. They're not brushing in front of, especially ones that are not stable on their feet. This is their most stable. They are literally sitting on a higher level toilet with a plastic thing that rolls over it, and they've got two handles they can hold on to. And then that way the head could be lifted up by the caregiver. They're stable and they can brush their teeth there.
wow.
So the term is toileting. It's actually
Toileting.
used in the federal guidelines for ADLs, or activities of daily living, toileting. And that is what
Wow.
is assumed. The brushing teeth is not part of ADLs, but it's assumed under the definition of the word toileting. So yes, and I have a resident patient that's how they brush her teeth every day, and that's how they get it done. And you know what? Her mouth is immaculate. I'm
Wow.
thrilled. She's got a little marginal gingivitis above 8 and 9. I'll live. She'll live.
So will she.
So, I was, I mean, these are things that I'm still learning. about, 18 years in me doing this. So yeah, so I'm going into the bathroom first. If it's after lunch, I know they haven't brushed their teeth. I'm going to bring them into the bathroom first. I want to watch them brush their teeth. I want to see how they're doing. And this also goes for my patients that are coming in to my office. If, the daughter will bring the mom in and they're having a day, right? Daughter's taking the day off of work. Mom's, she's bringing mom in. They've gone out to lunch. I do not want that patient now in the chair with lunch in her mouth. So I'm going to hand them, or I'm not going to actually do it. I'm usually with the patient. I'm going to be making sure that my front desk coordinator is handing the daughter to the mom, or the mom herself, the toothbrush and the toothpaste so that she can brush her teeth. I've got ADL approved, American Disability Act approved, ADA approved bathroom, so the two of them can go in there together. There's enough room. And then I've got the daughter watching mom brush her teeth. And now I've got the daughter engaged.
Nice.
Because at that point, she's going to be like, oh my God, she brushed for 20 seconds and she didn't. Yes, let's talk. So
Like
I do
dealing
the
with your
same
child
thing.
again.
Yeah, exactly. Exactly. And because now I've got the daughter involved, it's like, oh my God, I had no idea. How can we help mom? Yes, let's do this. So it's the same thing with long-term care communities as well. It's the same thing there. I want to see how they're brushing their teeth, and this is going to be really good information. There's either we can remind the patient to brush their teeth, we can monitor them to brush their teeth, or we're actually brushing their teeth for them. And those are the different stages that I find to be useful. And so this is information I carry on to the caregiver. Well, Mrs. Smith really isn't brushing her teeth all that well anymore. She brings it up to her mouth, but she's really not brushing. We're going to need someone to brush her teeth for her. Let me show you how. And then I introduce, get a load of this, tell, show, do. Tell, show, do.
Wow. We are
We
back
do
to
tell,
our
show,
infants
do
again.
with our
Nice.
residents, and it's amazing. Works every time.
Beautiful. So
So
we've checked the bathroom. We've seen what we've actually gotten there. We get to the mouth now. What are we
Yes.
seeing, or what are we looking for in the mouth?
So I'm going to take one step back. So when someone is admitted into a home, if they do an oral exam at all, it's an oral exam, not a dental exam. We don't know what we don't know. They don't know what they haven't been taught. So if the person has an oral exam, and I say if, then they're not really looking at the teeth. They're not looking at how many teeth are in their mouth, or really not, unless of course it's plainly obvious this person is a dentalist, right? They're walking in without any teeth at all. Then it's plainly obvious. But this really affects their care plans and what kind of what kind of meals they're going to be getting, what kind of foods they're going to be getting. So are they going to be getting a regular diet like us? Are they going to be getting a mechanical soft like a pot pie? Or are they going to be on pureed foods? And this is really how they're preventing failure to thrive. Also, do they have dysphagia? Do we have to worry about swallowing? Are thickeners going to be added to their water in order to make sure that they can drink appropriately, or their juices? Well, thickeners have a ton of sugar in them. A lot of them are honey-based. So as soon as I find out that this person is on thickeners, I'm immediately prescribing the fluoride toothpaste. And I want that prescription done through the home. Why? Because then it's their responsibility to make sure this drug is administered. And it has to be administered per my physician's orders, which is a legal document, twice a day.
Nice.
So this mouth has to be brushed twice a day. Medicare will pay for and do a 90-day supply when it comes to toothpaste. So I get a reminder from the nursing homes, or I have it alongside if I know the home is not going to remind me of when someone's for Medicare to pay for the Prevident or the generic equivalent, to make sure that I resupply them with that prescription to prevent new decay.
Nice.
So these are the things that I need to know ahead of before I'm even doing the dental exam and the oral exam, because in this situation, they are two completely different things, and how the nurses view it, how the director of nursing views it. So what am I looking for? I'm looking for any lost restorations. I'm looking for fractured teeth. If they've got fractured teeth, are they grinding their teeth? If they're grinding their teeth, are they on the Alzheimer's medications like Aricept, Diazepam, that causes grinding of teeth? And as more of our residents or more and more patients are going to be living with, not suffering from, living with Alzheimer's, then they are going to be walking in, potentially still driving. I have a patient right now who's on Aricept and is still driving, and he was diagnosed 9 months ago. So we start early diagnosis, fantastic. They're going to be grinding their teeth. He's never ground his teeth before in his life. He's now has daytime bruxism. How to make him a mouth guard. We know this ahead of time. We can make the mouth guard for him. We're not going to see fractured teeth. right? We see this more with women than men. Women, there's 1/3 of us that are walking around not knowing we may have osteoporosis or osteopenia. So now we have this, and now we are on Aricept or memantine, another Alzheimer's medication, and now they've got broken down teeth. Now they're in mid stage. I can't make them a mouth guard at this point, and they're just not going to wear it.
Yeah.
So, and let alone for me to take the impression to do it. But so what do? We monitor once again baseline. Are they failing to thrive? Are they losing weight? Are they not eating socially with their people at the table? Once again, nutrition is so huge when it comes to situations like this. I'm looking to make sure that they're eating appropriately based on what they have in their mouth. So what else am I looking for? If they have a denture, is it working for them? Is it loose? Are they using the denture adhesive appropriately? I can't tell you how many times I've shown how to properly use denture adhesive. A lot of times they'll just put it in, they'll put it in, throw it in their mouth, and walk out the door. There's no pressure being applied. There's no pressure being applied bilaterally. There's no pressure being applied at the palate. Especially for the lower dentures, there's no pressure being applied to allow that adhesive to engage. So there's education. I use the code 1330 so much, which is oral hygiene instructions.
Mm-hmm.
I use that code all the time, and I charge them for it because, especially if I'm spending more than 20 minutes on this, and may not be with the family, I may be doing this with the caregivers and the nurses if they want to get involved. But I'm charging it anyway because that's my time, and
Sure.
I really want to show the value of the importance of what I'm doing besides actually working in their mouth. So partial dentures, are there any broken clasps, so on and so forth. So
Nice.
these are the things that I'm looking for. And most importantly is I just want to make sure they're getting their teeth cleaned on a daily basis. And how are they going to be cleaned appropriately based on the condition of the resident?
Hey, and this isn't even things that just only apply to, say, a care facility. This is things
No.
if you've got patients in your own chairs, in your own office, your personal office,
Yeah.
private offices, you're still looking for the exact same things.
Yeah.
Are you using any products or anything like that to test the saliva? I've heard you say once a long time ago, but it's even within your website and everywhere else that you talk about having healthy saliva as well.
Mm.
Are there different products you
Yeah.
use to test that kind of stuff?
I do. My oral DNA. I'm a big fan of my oral DNA.
Yeah.
There's a new one that's coming out, or that's been out there that's tests other things, but I specifically have been using at the moment my oral DNA. I'm a huge fan of it. I really get to see what kind of bacteria, especially if they're not responding well to SRPs. I do also do laser treatment as well. I've got my little 2 volt or 2 watt, I should say, NV laser. But I love that thing. I use that thing all the time. I've worn out 2 of them. I'm on my third. And I love it. I mean, I not only can I do frenectomies with it, but I love doing, laser bacterial reduction therapy. I'm a huge fan of it. And I bring it to the nursing homes too. I bring it to the homes as well. In fact, I'm going to be doing that on Monday. I've got a 102-year-old resident who had all on 4 fixed, and those implants are now failing. And why?
Mm.
She's 102, so I'm going to
That's
be
a
doing some
tell.
laser therapy on her. And I'm going to, and I'm so thrilled that I have that capability. I'm certified obviously to do so. And that, yeah, I can scale, and there's not enough Paradex in the day. I'm going to get in there with that ortho length, which is, that's the only one I buy. It's 6 millimeters. And I'm going to get in there and go to town, with a pulse swat and then a continuous swat, as long as she lets me. And it's considered palliative. She's in hospice, so it's considered palliative treatment. I'm not, doing anything crazy here. But I really want to make sure that even though I scaled and I did all that stuff, I really want to make sure with all the threads that I could feel,
Sure.
that I can really get in there with that laser. So I use that a lot too. Big fan.
Nice. Uh, we could continue talking about this stuff forever. We haven't even gotten into the treatments. In fact, Matthew, we haven't even heard from you yet. So my curiosity out of this, there's a need for. I mean, we've gone through some of the diagnostic dynamics of what we actually are looking for, whether it be in the care facilities or it be in our own offices, the saliva, the going into the bathroom, which I think is brilliant, by the way.
Thank you.
If we can get into some of the actual treatments, you said that some of the things that you use, the fluoride varnish, the SDF, I'd love to go over how we utilize SDF. And that's right up Matthew's alley for this kind of stuff as well. So if you don't mind, we would love to actually do a kind of a follow-up podcast with this, just
You
to
got
kind
it.
of go over some of the treatments and things that you can actually do to the patient to help arrest some of those issues that you're actually seeing. But that doesn't mean you're going to have to come back and deal with us again if that's okay with you.
That's perfectly fine. I
I,
appreciate it.
I
Thank you
like where
so
this is
much.
going. Oh, absolutely. So, for those of us from Dental Advisor, thank you very, very much for joining in with us. For those that are trying to find out a little bit more about some of the preventive dynamics and the evaluations that we actually do within the organization, go to our website, dentaladvisor.com. There's even been a recent publication talking about some of these preventive measures and things that we actually utilize and use and things we've done evaluations on. You can even go onto there and ask for some of the products themselves, and you can demo some of those things yourself just by going onto the website. So, dentaladvisor.com. Again, Dr. Joy, thank you very, very much. And for
My
those
pleasure.
of you that have been joining us, we'll see you the next time through. Thank you very much. Have a good day.